Welcome to We Are Valley, a podcast by Valley Medical Center, located in Renton, Washington. We Are Valley is dedicated to providing you bite-sized advice to improve your health and well-being, and keep you updated on the latest medical guidance. This podcast is for informational purposes only and is not intended to be taken as medical advice. So please talk to your provider before making changes that will affect your health.
Hi, folks. This is Alex McGuire. I'm one of the producers of the We Are Valley podcast and your host for today's episode. In this conversation, we're going to be digging into the topic of lifestyle medicine, which is a really unique and valuable offering that's part of Valley's clinic network and services. I'm really excited to introduce you all to our guest today. Thomas Hammett is the Director of Operations for Pinnacle Medical Wellness and a doctor of physical therapy. Thomas, thank you so much for joining us. Welcome to the podcast.
Yeah, thanks, Alex. Really appreciate you having me on.
Absolutely. So, Thomas, I would love for you to tell us a little bit about your background. And then lifestyle medicine is a fairly unique concept. Can you break down for our listeners what we mean when we say lifestyle medicine?
Yeah, I'd love to. So I went to physical therapy school. I didn't know that lifestyle medicine was a thing that existed. I was aware of, a few things in particular that, physical therapists deal with exercise, right? And that we have a role in potentially helping people get more active. And I interviewed at this really interesting place, which you mentioned, called Pinnacle, right as I was coming out of school, and thought, man, these guys have figured something really interesting out. This idea that we have a bigger picture health responsibility as medical providers. We have an opportunity to do something that helps them not only get back to the place they were before, but potentially improve their health beyond that state. It was really interesting to me. I was like, okay, I don't know if I fully understand how to do this, but I really want to try, and I'm going to take this as my first job. Little did I know a couple of years later that clinic would sell to Valley Medical Center. And this is how I'm kind of in my role of being our director of operations today. Pinnacle manages all of the lifestyle medicine clinics and associated service lines that are Valley clinics. So I work in Valley. 90% of my job is spending time at Valley Medical Center, helping to support staff and promote really what our message is, which is where I'm going to get to answering your question of what is this lifestyle medicine thing? And there's a few ways that I think are best to answer that. First is the broad idea of we can go beyond sick care and provide something that what we call healthy care, right? Like putting a focus on health promotion in medicine. There are all kinds of systemic reasons why this is hard. It's not like medical providers don't want to do this. It's all kinds of things in a system that reinforces that you actually only get to access medicine when you're sick. Can we do something in a way that challenges that and provides a different opportunity? There's actually a certifying organization called the American College of Lifestyle Medicine, and they have defined lifestyle medicine as the medical specialty that uses therapeutic lifestyle interventions as the primary modality to treat chronic conditions or prevent chronic conditions. And, there's some medical jargon in there, but can we focus on lifestyle in a way that helps patients both better understand the trajectory of maybe where their health's going, and think about prevention through those means, not just by providing medication or the reactive approach to care. So what it looks like in our department is something I'd be happy to share, but I feel like I've maybe given a good enough introduction to the what that I probably should stop talking and see if you have anything you want to clarify.
Yeah, let's get into it. Valley has a lifestyle medicine department. What does that look like? What does it mean to have a lifestyle medicine department as part of kind of a larger network's offerings? And I think we should talk about kind of what makes it unique and special, because I don't think it's something that a lot of other healthcare networks have.
Yeah, I think it's really important to go beyond that, the why, to help people understand how they would even engage in something like this, why they would seek care at a lifestyle medicine clinic. So first, we have a specific set of service lines that are lifestyle medicine services. And what I want to say is that, a lot of these services are the same things, not all of them, but some of them are the same things that are delivered in a not in a lifestyle medicine model, like physical therapy, cardiac and pulmonary rehab, even diabetes education and nutrition counseling are all services that are offered at a typical hospital system, really, though not always nutrition services. And we're really lucky to have a pretty robust nutrition counseling service line here at Valley. What makes those services different is that they're run under the idea that we incorporate a bigger picture of health and this idea of going beyond just let's get back to where we were before we got started with you in the way that those services are delivered. So physical therapy in our lifestyle medicine department looks different, and diabetes education looks a little bit different. And, beyond that, there is a service line that is unique, I would say, to what we do that's called medical fitness. So we offer a set of exercise services that are really meant to meet people where they're at with the challenges that exist in trying to live a more active lifestyle and incorporate exercise for medical purposes. But I think that's a good place to start in terms of what those services actually are. So physical therapy, cardiac and pulmonary rehab, nutrition, diabetes education, and then medical exercise. And of course, in being a department and set of departments, we have this really wonderful opportunity to work with any group within the Valley network in terms of like collaborating and sharing patients, right? Like pretty much any condition that you might be presenting with, there's a good likelihood that nutrition and exercise could be part of either the solution or part of a bigger picture long-term plan to help manage what's going on. Think cancer, or like somebody who presents with diabetes to an endocrinology clinic, think cardiology. Like all of these medical specialties are places where a more active lifestyle and support with nutrition and food choices is something that could make a big difference. And a lot of hospitals don't have that direct place to send people that is so clearly outlined as part of the solution. So it's just really cool that Valley has invested so much in making that a priority. Has clearly delineated lifestyle medicine as a department. So it's just really cool. It's a really cool thing that Valley offers that I hope people get to learn about through this podcast.
Likewise, as somebody who hasn't always been within the Valley ecosystem, it's so cool even for myself to be learning more about, when I'm walking through the hospital and I see like our check-in area for the lifestyle med department on our main campus, right? Like knowing that we have this interdepartmental umbrella of collaboration that really have this through line of a mission that lifestyle medicine provides, it really creates an opportunity for integrated care for sure. Okay. Let's talk a little bit. So one of the things that I know you and I have talked about in other discussions as well is that oftentimes people see, a locker room area, they see a check-in area, and they see some exercise equipment. And, one of the things that you might think to yourself is, well, what makes a lifestyle medicine department different than a gym? And I think that's not necessarily like an unfair question, but there's some nuance to it, right? So let's kind of like talk about that. What sets aside lifestyle medicine apart from quote unquote a regular gym?
Yeah, I really appreciate you asking that question because it's one of the primary questions we get. And frankly, Alex, if I'm being honest, our pricing for fitness memberships is not meant to compete with those of a bargain gym membership, right? And the model of the traditional fitness industry, which is let's get as many people to sign up as we possibly can at our facility, and of course provide them amenities that they can serve themselves to. But really, like, kind of figure it out. Sign up and figure it out. And if you want more support, you can pay someone to do that through personal training or whatever. But your experience with the personal trainer is going to be based on what the personal trainer knows it does. And we're not at all trying to compete with that model because we know it exists already, and that isn't serving on our mission. What we know is so many people come to us with negative connotations around exercise, with like a background of not having a good introduction to exercise and fitness in gym class, and the feelings associated with that introduction follow them for the rest of their lives, and maybe trying to sign up for that gym membership and feeling unwelcome or intimidated. We use this word gym intimidation, which is a real thing, by the way, to walk in and feel like people have eyes on you the second you go into a fitness facility. The what do you wear and what are you supposed to look like, and What am I supposed to do when I get here? Are all real questions that people have that make it feel like fitness is so inaccessible at the level that it's served to those basic gym memberships. And again, the fitness industry wants to sell lots of memberships and hope that like maybe 20% of the people that have memberships actually show up, right? They couldn't serve everyone that signs up for the membership. And our goal is the opposite of that. We want every person that comes into our facilities to be engaged and working with someone to hold them really accountable to what they're hoping to achieve, right? Which means that there's some follow-up on, like, are you coming in to do exercise as you hoped, aspired, and planned to? What are your barriers? What are your challenges? And what are the successes on a regular basis? So from a how we deliver that standpoint, if you sign up for our exercise program, you're not signing up for a passive gym membership where you show up and figure it out. You have a fitness professional that is medically trained, assigned to you. And what they'll do is take you through the steps of assessment. So looking at domains of health that we know can be improved and monitored by exercise, and making a custom plan for you to start working on, okay, I know I want to improve my, let's say I have type 2 diabetes. I want to improve the management of my A1C. I also want to be strong enough to, let's say, lift a suitcase over my head when I'm getting on a plane. So we'll set some both physiologic goals of, I want to improve these medical areas that we have tested. And that can be like blood pressure or cholesterol. It could even be strength or your aerobic endurance, which are things we test for, as well as those functional goals. Like, I want to be able to get up and down off the ground. I want to be able to lift a suitcase over my head. I want to be able to climb Mount Rainier, though that's not often people's goal, right? So we're having consistent follow-up with people based on those goals. And, the last part that I'd say that's underappreciated is when people a lot of the time start a fitness routine, right? Like, they do really good at getting started, but that element of progression and varying exercise selection is really hard to do unless you've done it before. And the value of ongoing support and someone who knows how to push you in a way that's safe but effective it's both how we prevent injury and keep people engaged in the long run. And those are all aims of what we attempt to do in our program by the way that we've set it up, by the way that we've trained people. And hopefully this all makes it clear why this is a different thing than signing up for a gym membership, right?
Yeah. You introduced us to some terms that I think are really valuable to paraphrase and just kind of reemphasize. Like, when you talk about the fact that the average consumer is kind of left in their fitness journey and in the fitness environment to figure it out for themselves. When you say gym intimidation, I have definitely felt that, and I'm sure many other people have that thing of, well, I don't know what I'm doing, and everyone's going to judge me because I'm sitting here trying to figure it out, so I'm just not going to start. Or, maybe I did, but that was too frustrating and I'm embarrassed and I don't want to go through it again, are real things. And what we can do is build positive environments that solve for that and acknowledge that that's a barrier and, work around those things. Or again, like you said, meet people where they're at. And, maybe you're really confident in this area. Oh, you're not as confident in that? That's okay. I also really enjoy the way that when we talk about very specifically lifestyle medicine, we're looking at it as that big picture, right? We're looking at this as a component of your overall health. We're looking at it as a component of how can we improve and get you to, concrete goals? Because if you want to be, confident and able to do certain physical activities without having those stepping stones really solidly in place, that can lead to injury. What if you busted your rotator cuff doing motions that you haven't done super regularly or built up your muscle strength around? I think those are real life examples that really put weight behind what we're discussing.
I'm glad that resonated with you, Alex. There's one thing I want to say before we move on from this point too, which is I think naturally, because we have an exercise service line, we're compared to fitness. And I have to undo a lot of the thinking around traditional fitness because it is so scary and it's not a welcome place for a lot of people. But what I want to make clear is that I don't think Valley has, nor is it really our purpose necessarily, to fix fitness, right? Like, it's not to fix traditional fitness or to stand in as what everybody should be doing. necessarily from a fitness standpoint across the world. I would almost think of it, I do think our fitness services are quite good, but I would rather think of it from the sense of like, if you got a diagnosis of type 2 diabetes, or let's even say even better, your doctor tells you have pre-diabetes, and the option that you're given is take a medication and move more, and that's all you get. Is that enough? Like, is that, as a hospital system, is that us serving people at a level that is the best possible way and giving options that go beyond take the medication and figure it out on your own? And if we know that exercise is medicine for these conditions, for so many of these chronic conditions, can we help make that accessible to people and meet them where you're at? Which I really appreciate you paraphrasing that point. So much of it is, can we make this a medical offering that truly does stand next to take this medication, that stands next to have this surgery, and maybe even replaces that in some cases, right? If the options are have this invasive knee surgery or try 16 weeks of exercise and nutrition change and see if it resolves itself, I know which one I'm going to try first, right? Like, I would try the nutrition and exercise change if I know I could avoid a surgery, and people should have that opportunity. So that's really, to me, if I could say why we exist, again, it's not to fix traditional fitness, but a lot of the reason for helping people understand, I have to use some of those analogies, but hopefully that makes sense as far as why I believe it's so important for this kind of thing to exist.
I think it's also really important to just really emphasize it's not fair or practical per se to really compare lifestyle medicine to a traditional gym model, because exercise it is a component of what encompasses the lifestyle medicine department, right? Like when you talk about all of the other offerings related to, chronic condition education and nutrition and physical therapy, those are all things that also fall within the umbrella that makes up lifestyle medicine as a department here at Valley and as a concept. And to say that, to boil that down to just exercise and just, moving your body, I think is unfair. All right. So we've mentioned chronic conditions and we've talked about very specifically diabetes. Can you name off a couple other chronic conditions that might be a reason that you would want to pursue utilizing lifestyle medicine services?
Yeah. What's great about this to me is, I can start with diagnosed conditions, but I would even say, like, let's just identify factors that might be really good indicators for it's time to start thinking about that, which maybe the first indicator is like, are you alive? And do you not move your body or think about what you eat actively right now? And, because I think everybody has a goal somewhere in their mind that they'd love to live as long as they possibly can, and to do so with the least amount of like sickness burden during the time that they're alive, right? So like anyone who is interested in getting resources about doing that is a really good person to come to our department. Now, I say that, but I also know that there's tremendous power in meeting people at a place where it's kind of like a crossroads, right? Like I have this cardiac condition. So like I love using heart failure as an example, because the statistics around people with heart failure engaging in lifestyle change is it's disappointing to me at a systemic level. It's not like I would never blame people with heart failure as being the ones who aren't making the change on this. It's at a systemic level, we're not doing enough. There's a statistic published by the essentially the certifying body for cardiac and pulmonary rehab that states only 1 in 30 of the folks that would qualify to do cardiac rehab get referred in the first place. And cardiac rehab is an incredible program. It's 36 sessions of covered by insurance exercise programming tailored to people who have cardiac conditions. And really proud of the program that we offer here at Valley Medical Center. That's a part of the lifestyle medicine department. Our cardiology team that we work with and Dr. Bush is incredible at making appropriate referrals. Our statistics, I can tell you, are better than the national statistics on referrals. But this is one in particular where heart failure is not a death sentence by any means. It is something that you can live a long time with. It's not destined that you're going to take this trajectory that is constantly downhill. You can maintain current status for a long time. And exercise and nutrition and stress management are all really important components of that. So that's one specific example I want to share. from a like what condition would really benefit. Of course, pre-diabetes before you've developed type 2 diabetes, there's a chance to prevent and reverse, or at least stave off the development of type 2 diabetes. And exercise and nutrition, again, are two major components of doing that. As a physical therapist, what I know is a lot of people present to PT with injuries that are part of a bigger health picture. And the first symptom of the bigger health breakdown is my back hurts, or my knee started aching and it hasn't stopped for the last 3 months. And, we can say that that's just a joint issue or just a muscle issue, but the reality is that joint or muscle issue is often part of a bigger picture of health. And reducing pain in physical therapy is, it's step one to me. And PT is such an important service for helping people be able to move again, because when you're in pain, gosh, it's tough to move. It's tough to be more active and focus on anything other than the pain. But once you're out of that pain, that can't be it, right? For a lot of people, living a more active lifestyle after that is what helps you prevent injury, prevent illness. And, that's another really good example of, if you're having recurrent musculoskeletal issues, getting hurt at work often, it's time to think about how can I prepare my body for the actions I do in a day-to-day life as a person. And again, another really good reason to think about using lifestyle medicine. So, yeah.
All right. We've talked about how comprehensive and great of a approach lifestyle medicine is to really improving your holistic physical health. What does it look like if somebody is interested in utilizing lifestyle medicine services here at Valley?
That's great. You've given me the tee up for telling people about how to access this, and I love that. So the hardest part, I think, to start with is people. When I talked about being at a crossroads where something has to happen, sometimes it's hard to figure out, like, deal with my nutrition first? Do I deal with the exercise part first? Do I do it all at the same time? I think it's really natural to come to a place where we've concluded, okay, I can't keep going on this same trajectory.
Yeah.
But then the question is, well, what do I do? And I think the answer is going to be different from person to person. What I'll tell you is that, so we have some services that are covered by insurance, physical therapy, if you're dealing with musculoskeletal pain, or just generally like a fear of movement or barriers to movement, say stiffness, weakness, any of that is like, man, that's why I'm not more active than I am right now. That's a really good place to start. PT can be step one to living a more active lifestyle. You can actually access a physical therapist without a referral. It is covered by most insurance plans. So really easy to access. That's, available to book, calling our departments. You can also ask your doctor for a referral if you want. When it comes to nutrition, some people know that the first step they want to take is a nutrition change. Our dietitians are such valuable resources. And I think a lot of the time people are afraid to go to the dietitian because they're afraid they're going to be told that they can't eat their favorite foods, or they have to stop eating a certain way, or, there's also this element of like food feels like something that we should be able to figure out on our own. And like, does somebody really need to teach us how to do this thing? There's so much value in just being able to tell someone what you're struggling with food, and to talk strategy and to get feedback on the questions that you have, because everyone has questions about what they're doing with their eating. And if that's the reason that you go there in the first place, that's a super good reason. But again, if you're thinking about like, I want to manage this medical condition, is medication the only way to do that? The answer is probably no. That food is an element of how you can both manage and address, some of the symptoms or the condition that you're dealing with. These people are the experts at helping us do that. You don't have to figure this out on your own. Again, if food is the way that you want to start, there's so much value in starting with that direction. Last, of course, exercise. If you just need to get started with exercise and need the support that I talked about earlier, access our exercise programs directly. You can show up at our clinic, you can call. There's even online sign-up forms for interest that I'll make sure Alex includes in some form of show notes, because
they will be
spouting
there.
off the URL won't be helpful. But so signing up directly for any of our programs is something you can do now. If this feels overwhelming to you, which by the way, you would be in the majority if you fall in that camp, we have information sessions called Healthy Care Sessions that are meant to be, let's just explore this together. Let's take a minute, think about where we're at, talk about what our options are. Are you ready to make a change? And if so, let us tell you the ways that we can support you. If not, great. Come and learn a little bit more about chronic disease. Come and learn about some of the ways that you can be proactive in starting to address some of those things on your own. And that's a really good way to get an introduction to what we're doing. It's free of charge. We offer one per week at our varying locations in Maple Valley, Covington, and Renton, and is really meant to be an educational resource for people to just show up and learn. So those would be the ways that you can access us if you're interested in learning more.
Awesome. Well, like I said, I think we've covered a lot of ground. And to your point about, not wanting to overwhelm, I think this is a good place for us to maybe end it for the day. I highly anticipate that we will be doing future episodes that dig into maybe some of these topics a little bit more specifically one-on-one, but I think that is a really good stopping place for us. So our guest today has been Thomas Hammett, who is the Director of Operations for Pinnacle Medical Wellness. Thomas, thank you so much for joining us here today. We really appreciated having you talk about this with us.
Yeah, thanks, Alex. It was fun.
This has been We Are Valley, a podcast produced by Valley Medical Center in Renton, Washington, as a part of our mission to care for our community like family. If you liked this episode, be sure to subscribe to our feed for more great health content. And for more health resources or to find a provider, visit valleymed.org. Thank you for joining us.